Hello everyone. So the SAQ under discussion is physiotherapy management of lymphedema. Now we all know what is lymphedema. Lymphedema is accumulation of lymph. Okay, that is known as lymphedema, and lymph is nothing but lymph is basically a white color fluid flowing through the lymphatic channels and lymph nodes. Okay, so whenever these lymph nodes have been removed as a part of the surgical process or any kind of malignancy, the lymph starts accumulating, and the condition is known as lymphedema. Okay, and physiotherapy plays a very important role in management of lymphedema. Okay, so what are the points you should include if someone has asked about the physiotherapy management of the lymphedema? So the first point is intermittent pneumatic compression device. Okay, the first point is intermittent pneumatic compression device, and the second point is combined physical decongestive therapy. Okay, the third is hygienic limb measures, and the fourth point is decongestive exercises. Okay, these are nothing but the active exercises of that particular limb. So there are 4 points under which we are going to discuss the management of lymphedema. That is intermittent pneumatic compression device or intermittent pneumatic compression therapy. Okay, combined physical decongestive therapy, that is CPDT, hygienic limb measures, okay, and the decongestive exercise. So let's discuss point by point. So first is intermittent pneumatic compression therapy. Okay, so intermittent pneumatic compression therapy is nothing but a sleeve. If for example this is the limb with lymphedema, and so there will be a sleeve, okay, which will be worn on the limb, and this sleeve will create a gradient of pressure. There will be different pressure which will squeeze the limb from the proximal to distal. Okay, for example, this is the proximal distal part of the limb, and this is the proximal part of the limb. So from distal to proximal, the pressure gradient will give compression therapy, and the entire limb will be drained. Okay, so this is intermittent pneumatic compression device or intermittent pneumatic compression therapy. Okay, second is CPDT. That is combined physical decongestive therapy. Okay, so combined physical decongestive therapy has, first part is manual lymph drainage. Okay, second part is compression garments. Okay, so combined physical decongestive therapy consists of 2 parts, that is manual lymph drainage, and once the manual lymph drainage is done, manual lymph drainage is the massage what we give to the limb, okay, to drain the limb from distal to proximal. Okay, that is manual limb drainage. And then after once the manual limb drainage is done, the compression garments have been given to the patient. The pressure of this compression garment is from 20 to 50 mm of Hg. This is to maintain the drainage which has been performed by the manual limb drainage. Okay, so that is the second part of the management. The first part was intermittent pneumatic compression therapy. Second part is the CPDT. Third part is limb measures, limb hygienic measures. Hygienic measures. Okay, where the patient has to take care of his limb, like to inspect the limb for any cuts and wounds. Okay, then keep the limb dry, wear proper fitting shoes, cut their nails properly. Okay, so these are the limb hygienic measures. Okay, and active exercises. For example, if the lymphedema is in the upper limb, then decongestive exercises, the fourth point. Decongestive exercises. Okay, so decongestive exercises, for example, the lymphedema is in the upper limb, then wrist movements, elbow movements, okay, all pumping exercises, basically muscle pumping exercises should be given. Okay, so let's revise. You can elaborate the management of lymphedema under 4 heads. Okay, the first one is the intermittent pneumatic compression therapy or device. Second one is combined physical decongestive therapy. It has 2. One is the manual lymph drainage and compression garments. Okay, third is hygienic limb measures. And fourth is decongestive exercises. Nothing but the active exercises. You can also add elevation with active exercises. Okay, so this is the management in short. If you cover all these points, then definitely you may get 3, 5 or 7 marks in your exam. Thank you.